Well, you say the same thing, right? And welcome to the frequently asked questions section on dental specialties. Our first frequently asked question is, do I need to be referred by my dentist to see a specialist? And the answer to this is absolutely. I think it's important for the specialist to receive a request from the dentist and also for the specialist to get some sort of feedback from the dentist as to what the dentist sees the condition to be and what the dentist wants the specialist to take a look at. So yes, you need a referral to the specialist. The second frequently asked question is, what does an oral pathologist do? So the oral pathologist as a specialist is trained in many areas of the potential bad conditions that may be happening in the mouth beyond the teeth. So usually soft tissues and the gums and the bone, etc., may have conditions that are part of the whole body that are affecting the mouth. And so the role of the oral pathologist is to look at this and come up with some sort of a diagnosis that is more accurate with regards to what's happening to these tissues. The next frequently asked question is, how is oral medicine different? Oral medicine is different from just general dentistry in the sense, again, that the oral medicine actually looks at all of the tissues in the mouth, whether they be teeth, they may be gums, bone, all kinds of other ligamentous tissues. It could be the temporomandibular joint. So the oral medicine actually looks at all of these conditions that fit in with the systemic issues that may be going on in the patient's body. The next frequently asked question is, what is a TMJ evaluation? So TMJ actually stands for temporomandibular joint, which happens to be the joint on the right-hand side around here and another one on here, which actually allows your lower jaw to function with your skull. And there are times when patients have some symptoms and issues relative to that. And it is important, if the patient presents with certain symptoms, for the dentist to then diagnose as to the reason for the patient feeling these symptoms. So the TMJ evaluation is that particular evaluation to see why the patient's getting symptoms with regards to the lower jaw in function with the upper jaw. And the final frequently asked question we have here is, what do I do if I find a lump in my mouth? And the answer to this would be, you need to go see your dentist right away. And most of the times, the dentist will be referring to a specialist unless it's something that the dentist figures is because of a tooth or an infection that he or she can take care of. But when you feel a lump in your mouth, it's not to be taken lightly. You need to see your dentist right away. And thank you for attending to this section of frequently asked questions in the area of dental specialties.